Hello and welcome back to another Moment with me, Dr. Saleeby. We're going to discuss today a little bit about LDN, Low Dose Naltrexone. Low Dose Naltrexone is on my short list of good meds. This is a medication that's been around for quite a while, but it has some off-label uses that make it very appealing to functional medicine and integrative doctors, especially those who are dealing with people with autoimmune disease and cancer. First, a little bit about the history of LDN and naltrexone. So naltrexone was discovered and patented in 1963 and was used to treat folks with opioid or heroin addictions. Over the period of the 60s, 70s, and 80s, doctors noticed that those who were on naltrexone had some amazing regressions of some autoimmune disease like MS and lupus and cancers and even HIV infections. The FDA approved this medication for opioid addiction, but it was actually further indicated in '84 for alcohol abuse. But what we're talking about is a very low dose of naltrexone, whereas the standard dose is 50 milligrams. We're looking at doses between 0.5 and 4.5 to 5 milligrams. One of the lead researchers in LDN research and the folks at the LDN Research Trust out of the UK tout LDN as a drug that provides 21st century biotherapy to stimulate the body's own defenses and restore control over chronic and systemic diseases. LDN brings order to cellular and humoral immune systems. There are different segments of our immune system called Th1, Th2, and Th17. When they're out of balance, things go awry, especially Th17, which is kind of responsible for autoimmune disorders. LDN seems to bring these three components back into balance. When there's low Th1 activity, you see a person with chronic infections and even cancer. LDN corrects this. An overactive Th2 yields allergies to food or environmental allergies. LDN seems to bring back this into proper balance and reduce pain and suffering with this disorder. An uncontrolled or out of control Th17 is responsible, like I said before, for autoimmune disorders, and LDN reduces the Th17 hyperactivity. While all the mechanisms of action of naltrexone are poorly understood, research has found a link between OGF, which stands for opioid growth factor, which is an endorphin, and the opioid growth factor receptor, also known as OGFR. Apparently, LDN attaches to this receptor, and that's where it enacts its magic. So it does control cell division, and that's what makes this a popular agent to use in cancer therapy. It'll knock out a lot of cancer cells that have runaway growth. What is LDN used for? Well, many autoimmune disorders that are listed on this page, several cancers, and oftentimes an infectious disease like Lyme disease, which is very difficult to manage and conquer. It is also used in weight loss at a higher dose than actually low dose. As far as evidence-based medicine goes, there's a lot of studies and a lot of proof in the literature. You just have to look for it. If you want to learn more about naltrexone, low-dose naltrexone, and ultra-low-dose naltrexone, and want to be managed by one of our providers at Carolina Holistic Medicine, please reach out to us by phone, 800-965-8482, or visit us on our website. Thank you. See you next time.